And my favorite part of the presentation, obviously, is prevention. Because it's extremely important to know that early detection has a 98% cure rate. That's unbelievable. For a disease that's killing 48,000 women a year, that has a 98% cure rate. And even more importantly, 70% of cases of breast cancer are found by you. So that just gives you that power now to know even more the self-examinations, the awareness, and the prevention. And even more importantly, which I love this stat because it affects my mother, after being cancer-free for 4 to 5 years, 98% live a cancer-free life. So that's even more fantastic. Who gets breast cancer? More common among older women. Sure. We know that there was a story that somebody shared that their 27-year-old neighbor got breast cancer. And you know, and there's certain cases like that. We are finding now that younger women are getting this disease. Is it environment? We don't know, because some of them don't have a family history of breast cancer. So we can't always rely on that. But we know, yeah, older women have a tendency to get the majority of the cases, so that's why there is such a pressure for them to get tested. But let me tell you, my 2 sisters now get tested every year, and they're in their late 30s. So more than 3/4 of the women who get breast cancer are over the age of 50. White women are more likely to get breast cancer than African American women. Give yourself the breast self-exam at least once a month. Look for any changes in the breast tissue. Women in their 40s who have a strong family history of breast cancer or other risk factors may start as their early 30s. Now, and that's great. That's so powerful, that information, because right now, the latest news that came out, the controversy behind is that women, even in their 40s, should go get breast exams every 2 years. And because of the coverage and the benefits that you have, you're separate from that. And that's fantastic, but the studies are overwhelming. I mean, there's no reason why women should wait. They should get it every year, especially with family histories. But as you know now, a lot of these diagnoses now are from women who don't have any family history of breast cancer. Now, my mother didn't have any family history. Her mother died very young, so we didn't know if she could have had it. But my mother didn't have any family history. It was just, you know, something like that. So my sisters certainly have to be aware. So it's extremely important to make sure that if you're nervous or you have anything that you have questions about, that you just set that appointment up and go, especially when you have the type of benefits that are here. Okay, prevention continued. Now we're getting to my 2 favorite subjects, exercise and nutrition. You know that would have to be in there somewhere, right? Exercise. What we know about exercise. Now, for me, when I looked at this from a breast cancer prevention, obviously this is a bigger, wider scope of prevention, from a overall health to all cancers. But we know from a perspective of breast cancer that it does pump up the immune system, lowers estrogen levels with as little as 4 hours of exercise per week. Can lower your risk of breast cancer. Now, that does not include strength training. So it's important that you include the strength training, even minimal, once or twice, because remember, that's even going to lower your estrogen levels even lower, which gives you more of a defense against breast cancer. Nutrition. A low-fat diet with plenty of fruits and vegetables can help reduce the risk of developing breast cancer. A high-fat diet increases the risk because fat triggers estrogen production that can fuel tumor growth. You know, that's something that's pretty common. I mean, that's a fact, that we know that. That's pretty much across the board in the majority of cancers, as we know, that that type of high-fat diet does increase your chances of breast cancer and many cancers. Cancer-fighting foods. Now, if you look at this list, here's funny. Tammy could probably laugh at this, because this is in the majority of all my presentations. So when I look at this list, and Lauren put this together, I look at this and I'm like, okay, this is kind of how I've tried to promote everyone to eat on a daily basis anyways. So as much as it is cancer-fighting foods, it's a matter of just health and wellness. Now, the one thing I added by myself, which I liked, was, I got a nice applause for this, was red wine. Now, the studies are overwhelming now as we look at what red wine and antioxidants do to free radicals. Now, what's a free radical? A free radical is the majority and the cause of the majority of cancers. Now, free radicals come from pollution, they come from lifestyle, they come from maybe listening to me. I could be a free radical, I don't know. A lot of different aspects of life, stress. Now, what we can do to prevent free radical damage that causes cancer is eat better, exercise, do these things. Now, one of the things is red wine has been overstudied, trust me, as a way to help control free radical damage. Now, I can endorse a glass a day. That's about what they say. But I can also endorse a